we're seeing a lot of growth in oncology, right? We continue to see a rising number of FDA-approved therapies popping up. With that, that also means we need to be more specialized. So we're seeing a lot more specialization just in the oncology arena for those therapies. So there's a lot of training and education that needs to take place. We've talked about ACCC has worked extensively in this training. They continue to work on this as well. And that's a huge area of development, is the fact that we're going to see more and more disease state, more and more immunotherapy, more and more side effect profiles in the oncology arena. But also, this will lead to the development of more specialty-based practices. So with a larger number, over 25% of these new agents coming out as oral, we have to address how those drugs are given, where they're given. Are they monitored? A huge area right now is, again, adherence. It's an old discussion for orals. In fact, we know that adherence based on the Adagio trial, which is looking at imatinib initially, had shown that certain outcomes were less if the patients weren't taking the drug on time or weren't taking it at a certain percentage. As these new therapies come up, will that also embark on our discussion on how those patients will have outcomes? But more importantly, as we kind of broached upon with OCM, with ACCC, if we have patients doing poorly and those patients actually have poor outcomes, they'll be coming to the clinic more often. That will actually increase our expenditures, which will then be addressed with OCM metrics as well. So making sure these new drugs, which are oral, have adherence measures will be very important in the years to come in addition to it. Other areas which will also be important will be new drug therapies and infusional therapies, but also the most important will be the combination, right? IV and orals. That's really going to be a very big discussion in the near future too.